once it does arrive, we know you will have a lot of questions about the rollout itself, like who can get it, just how effective will it be? Our Sonia Azad spoke with the incoming president of the Dallas County Medical Society to get some answers.
Okay, Dr. Kasanoff-Piper, we're going to get right to a bunch of great viewer questions. Our first one, do we know why 4 people from the Vaccine Advisory Committee voted this down?
Only one person has spoken out so far, and her concern was really not with the vaccine itself or any side effects or other concerns. Hers was just that she thought it should not yet be considered for people younger than age 18 because there had not been very many people under that age in the study so far.
Is there a difference between the vaccine producing antibodies in a person and a person who already has antibodies from contracting COVID? And kind of a follow-up here, will people who had COVID or have COVID antibodies be encouraged to still get the vaccine?
We expect that the vaccine antibodies are going to be longer lasting than the disease antibodies. But certainly at some point, we still think that everybody who had the COVID illness should go ahead and get the vaccine because we don't think that these antibodies are going to be lifelong.
Our next question, let's say you get the vaccine. Can you still get COVID-19 and possibly even pass it on to other people?
We know that the vaccine can help keep you from getting the disease or showing signs of the disease. But we don't know that it really prevents infection altogether. So we're not sure that it protects you from being contagious to someone else.
A lot of people are concerned with the allergic reactions that we've been hearing about when it comes to this vaccine. I think there were a couple of cases out of the UK. So what's your takeaway from this? Does this mean that if you have a certain type of allergy that you shouldn't get this vaccine? And then do we even know what those allergies are?
This is still being studied, but at this point, we think that people who have had the most serious of any type of allergic reaction, and that's called anaphylaxis. And that's the type of severe allergic reaction where you can't breathe, your lungs close up, it's very, very serious. People who've had that kind of reaction know that they've had it. And these are people very often who carry their own EpiPen around in case this reaction were to happen to them again. And right now, we believe that those people should not get the vaccine. But for people who have other kinds of allergies, so if you have seasonal allergic rhinitis, if you have skin allergies, if you're allergic to cats or dogs or something like that, we don't think that that's at all a reason to delay getting the COVID vaccine.
Thank you so much for your time, Dr. Kasanoff-Piper. We certainly appreciate the clarity and the insight you've offered us today.
Thank you.